An Indiana representative is introducing new legislation to urge hospitals to develop and implement safe discharge plans after a woman gave birth on the side of the road last month. Mercedes Wells says she was discharged from an Indiana hospital after 6 hours, even though she was in active labor. Just minutes later, Mercedes' husband delivered their daughter in their car. Democratic Congresswoman Robin Kelly is proposing the Women Expansion for Learning and Labor Safety, or WELLS Act, in hopes of preventing something like this from ever happening again. And Representative Kelly, along with gynecologist Dr. Jessica Shepard, are both joining me now. Thank you both for being with us. Congresswoman, I'll start with you. Beyond requiring discharge plans, what other policies are you hoping to implement with this legislation?
My bill aims to deal with systemic issues around maternal care, racial disparities, hospital accountability. None of these things were taken into consideration for Mercedes. She was there. She was discharged, didn't quite understand why she was being discharged. There was no assessment done of what transportation she had or how far she had to travel, and she did not agree with the discharge.
Just unbelievable that this was able to happen. Dr. Shepard, it's unbelievable that this was able to happen, but we know about the rates when it comes to maternal mortality and disparities in healthcare. Black women are 3 times as likely to die from pregnancy-related causes than white women. Why is having a safe discharge plan so important, Dr. Shepard?
Well, Janae, I'm actually going to take it back a step further. You said the word unbelievable. It's not unbelievable. This is actually believable when we think of the United States and maternal mortality and care of pregnant women here. Because when we look at the rates of what we think of industrialized countries, we actually remain the country with the highest rate of maternal deaths. So obviously these stories are believable. So the discharge plan, from any hospital can differ, but I think it even goes deeper than that, that we really have to look at what is racial bias and what is an inherent bias, and really looking at the system, because in the system are multiple people, multiple protocols, and all of these are flawed, which is why we have these outcomes. So I think that the WELLS Act is really one of the many ways that will help ensure that we have safety and that we have really that care, and taking away from racism when we think of medical attention when it comes to women who are pregnant.
Dr. Shepard, that was such an important point that you made in terms of the reframing around how unbelievable, but the fact that it is believable when you look at the data and the kind of stories that we see out of hospitals around this country on a daily basis. So a really important, still shocking point. Representative Kelly, you've worked on legislation concerning maternal health for nearly a decade. So what more can be done to fix this issue, especially for Black and brown women?
Well, we just had a forum yesterday, and we had an OBGYN with us. When Black women go to get checkups, they need to have someone with them. I believe in doulas. We have to advocate, for ourselves also. That is very, very important. We need to feel comfortable with the doctor, and also the challenge. And that doctor recommended finding someone that looks like you, because there's been studies that when you find someone that looks like you, the care is definitely better. There's studies around immigrants that have had babies in their native country, and then when they come to the United States, that's when they have the issue. So racism is systemic and a very important part of this. And even though, as a doctor said, it's not unbelievable in ways, but it's still shocking in 2025 when I think about Mercedes Wells and Carrie Jones in Texas, that we are still dealing with this.
100%, because regardless of how much or how often it happens, it shouldn't. And Dr. Shepard, when we do these segments, because we talk about these issues often, we're often, reminding folks that you've got to advocate for yourselves. But how can women better advocate for themselves, especially if faced with a doctor who might be ignoring their concerns?
Yeah, I think that there's multiple ways to do that. So to be short is to say that it should be more looked at over communication. We listed some of those things, such as having a doula, having an advocate, even having just another person with you, because when we look at the underlying social economic inequalities, a lot of that boils down to what is the actual communication that's transpiring between the healthcare provider and the patient, and ensuring that everything that is being communicated is understood. And if it's not, then asking for someone else to make sure that that communication is being transpired in a way that the patient is fully aware of what's going on, and and can also ensure that they get their opinion into that communication.
Important reminders. Democratic Representative Robin Kelly and gynecologist Dr. Jessica Shepard, thank you both so much for being with us to talk about a really important topic, ladies. Thank you.